I came down with an unrelenting sore throat about 15 to 20 years ago. For years, I have tried to be discreet in prescribing antibiotics in most of my patients for fear of causing resistance in bacteria to the antibiotics. I did for me what I did for most of my patients, which was to avoid antibiotics and the doctor. However, after a week, the sore throat was getting worse. It was starting to keep me from opening my mouth normally, and I was running a fever. I called my friend, an ears, nose, and throat doctor who practiced at our local clinic with me. He squeezed me into his schedule and took a look at my throat. I noted his eyes got a little wide, and then he got up and left the room, returning with a large syringe attached to a big bore needle, kind of hidden behind. It was so quick I didn't have time to resist, and he placed that huge needle into my throat and stabbed the left tonsil and came back with a syringe full of brown liquid. He smiled and said, "Oh, you have a peritonsillar abscess." I had pain localized to the left side of my throat, which made worse with swallowing and which was suspicious for peritonsillar abscess. Other symptoms that could have indicated such a diagnosis included swollen tonsil or tonsils, uvular deviation from the abscess, a mouth that doesn't open fully, purulence of one or both tonsils, drooling, swollen neck lymph nodes, and finally a muffled voice. Usually there are two organisms growing, which makes this condition a double threat. If the infection is allowed to spread, the invasion of many layers of neck tissue can occur, which leads to a progressive extension of the infection into deep tissue and possibly a dismal death. The infection can also spread to the other tonsil, which, when swollen and pushed up against the opposite swollen tonsil, can block airflow and cause death from suffocation. My doctor immediately sent me down to an infusion room and started the daily IV dose of an antibiotic that would be repeated daily for a week. This was not the first time or the last that antibiotics saved my life. Following this experience, I looked much more carefully at every patient with a sore throat, and although I was still careful about overprescribing antibiotics, I prescribed antibiotics more often for swollen and ugly tonsils after that.